Are certain cervical cancer types more aggressive? Imagine your body as a complex system where different types of cervical cancer behave in their own unique ways. Some grow slowly and are easier to catch early, while others can be more aggressive and spread quickly. That's because cervical cancer isn't just one disease but includes different types with varying behaviors. The most common type is squamous cell carcinoma, which makes up about 70 to 90% of cases. It starts in the flat squamous cells lining the lower part of the cervix. Usually, this type develops slowly over many years, giving plenty of time for screening tests like Pap smears and HPV testing to catch it early. When detected early, the chances of successful treatment are quite high. But if it spreads to nearby lymph nodes or organs, the outlook can become more serious. On the other hand, adenocarcinoma accounts for about 20 to 25% of cervical cancers and is becoming more common. It develops from glandular cells higher in the cervix that produce mucus. Adenocarcinoma tends to grow faster and is often more difficult to detect early because it can be hidden deeper in the tissue. It also has a higher chance of coming back after treatment and may respond less well to standard therapies like chemotherapy and radiation. This means patients with adenocarcinoma often face a more aggressive course and poorer outcomes. There are also rarer but very aggressive types called neuroendocrine tumors, including small cell and large cell carcinomas. These make up about 1 to 6% of cervical cancers. Small cell neuroendocrine tumors are especially fast-growing and tend to spread early to lymph nodes and distant parts of the body. They are associated with a poorer prognosis and requiring more intensive treatment. Other factors influence how aggressive a cervical cancer might be. For example, most cervical cancers are caused by high-risk human papillomavirus infections, but HPV-negative tumors tend to be more aggressive and have worse outcomes. Recent research has also identified molecular subtypes within these cancers, where some subgroups, like the C2 type in squamous cell carcinoma, show more aggressive behavior and weaker immune responses, especially in immunocompromised individuals. In summary, while the most common squamous cell carcinoma often grows more slowly and responds well to early detection, adenocarcinoma and neuroendocrine tumors tend to be more aggressive. They grow faster, spread earlier, and are often harder to treat successfully. Understanding the specific type of cervical cancer is crucial for prognosis and choosing the best treatment approach. Always remember, if you have concerns or risk factors, consulting a healthcare professional for personalized advice is essential. Regular screening and early detection remains key to managing cervical health effectively.